So I might just get you to describe what you think is the kind of palliative care service that we all deserve.
Yes, so I'd like to answer that first and then come to you about why I think not only is it a funding issue but a workforce issue that you just touched on as well in some of those areas. So the reason that it is important to have a specialist palliative care team and local health providers that aren't palliative care to also be able to deliver a palliative care approach is that we need a multidisciplinary or interdisciplinary approach. And palliative care has always been holistic. It's always been about both the medical, clinical, as well as the psychosocial and emotional and spiritual support at end of life. And when we talk about end of life, we're not talking about the last days and weeks. We're talking about from the time that someone's diagnosed with a life-limiting illness, or what we used to call a terminal illness, that really palliative care can be involved in using any of that allied health or medical nursing care right from the time of diagnosis if it's known that that person is likely to die from that particular illness. So palliative care can come in and out of someone's journey as that evolves. And actually the whole aim is not just about pain control and symptom management, it's actually about helping people plan to have quality of life and participate in those activities in comfort that they want to participate in. So for some people that could be a couple of years. For some people that will be the last few months of life. But I think there's this misunderstanding that has occurred across politics, across funding models and across our community that palliative care is just those last days and weeks of life, when in fact the whole model around that interdisciplinary model of care is support from time of diagnosis if that's what someone chooses. The second thing you talked about was about workforce and trying to attract somebody. Workforce is a massive issue. So in speaking to the politicians, many of them said, we find it really hard to attract people to rural areas. And at one stage I lived and worked in the New England area, very close to where you are in the Manning area. And we found it very difficult to attract people to work in those rural areas. And there's a whole range of reasons for that that we can go into if you have time. But I'll hand back to you and you can explore that further.
Yes, well, as you say, we had a breakthrough in the Manning Valley where they were able to get a trained doctor here, and the relief from an organisation like Push for Palliative was palpable, and that person has gone on to make an incredible difference. It's been a sigh of relief. So clearly, it's about having, as you say, medically trained people here. And in the past, well, you know, some communities are having trouble even getting a doctor, let alone a specialist palliative care trained professional. So I might just get you to pick that apart. Why is it so difficult to have trained palliative care medical professionals in a regional area?
I think it's not just palliative care. There's a whole range of challenges in trying to attract health workforce staff into rural areas. One is about comparative pay with metropolitan areas. One is about, I'm very much a believer in listening to clinical leaders in palliative care, that those support infrastructures are really important. So when I worked in specialist palliative care back in the 1990s, we were part of teams. And that meant that when we were, travelling some 1,000 kilometres to visit someone, we knew we had the backup of other palliative care staff, other community nurses, other health professionals that we could talk to, that we could coordinate with. And I think that the issue is that often people don't feel that they're part of ongoing teams that are supporting that particular individual. There's lots of lone workers out there. I think that's one aspect. The second aspect is we're being told that there isn't often enough money for backfill, what we call backfill when someone goes off to have training. So if you have a doctor who wants to go off and get some particular, or a nurse or a social worker who wants to go and get some specific further training, there's often not the money there or the people there to do that backfill. The third thing is that you need to have clinical supervision. I mean, you are working with people at end of life and you are working sometimes in confronting situations. So you need to have access to clinical supervision. So again, where do you get that clinical supervision? And if you have to travel to Sydney or you have to travel to another major regional area to access that, again, you need backfill and you need to know that you're supported. So we are at risk of people burning out as well. And I think those are just a few of the issues.
I'm speaking with the CEO of Palliative Care Australia, Camilla Rowland, and also with me this morning is the CEO of Palliative Care New South Wales, Linda Hansen. Linda, good morning to you.
Good morning.
You've been listening into our conversation this morning, and I might just get you to update us. We had the New South Wales budget delivered. I understand that there's quite a few things in there for palliative care. Just describe for me what was in there.
Well, it's a really positive announcement, I have to say, and I think, what Camilla says is exactly right. It's about getting a palliative care team together and a service that's supported in any regional area. And that's what's starting to happen up your way, and certainly that the Push for Palliative people up there have just done an amazing job, and they should be congratulated for their advocacy over the years. And this announcement, in fact, really does seem to support the provision of more community health services. Certainly the message I get from your area is that 24/7 community nursing is not available for palliative care, and that really needs to change, and that's what this announcement says that it will do. So it's a $743 million announcement for increased palliative care funding over the next 5 years. By year 5, it will effectively double the current funding that the New South Wales Government spends on palliative care annually. So it's currently $300 million a year. It will be $600 million by year 5. So that is an amazing announcement. Of course, it's not just about money, it's how that money flows, of course. And part of that package says there'll be an extra 600 nurses, allied health professionals, doctors and support staff. It's incredibly important to note that allied health professionals are part of the palliative care team, and social workers and others are part of that, as Camilla referred to, that holistic approach to caring for people at the end of their lives. But it's also about getting volunteers back on deck. So during COVID, volunteers, of course, have been sidelined somewhat for obvious reasons, but it's time now to really get them back as part of the palliative care team, and I think this funding announcement will help that. So it's a really welcome. There's a bunch of things within that announcement as well. There's increased hospital capacity, because I think people might not realise that 51% of people still die in hospitals in Australia. And there's a boost to hospital capacity for in-hospital palliative care teams there as well. Pain management, critical part of palliative care, will receive an increase in funding, and so on. So it's just a really good announcement that really shows some insight into the levels of the different layers of palliative care. So we're really pleased that the many approaches we and other advocates have made over the years have been heard.
So, given the news in the budget, for you, what do you see as the major priority going forward for a place like regional New South Wales and the Mid-North and Coffs Coast?
Well, yeah, as I say, it's about building that team. So there is a palliative care doctor there. There are palliative care nurses who have been there for many, many years and doing a great job. It's about building that workforce up a bit. It might be a matter of upskilling other health providers. There's probably been a lot of health providers who are really suffering under the COVID pressures and have maybe taken a break. It might be worth, and what we're proposing is getting people to reconsider their focus of their careers and have a look at training in palliative care. It's an amazing thing to specialise in. When once you're in it, you understand how special it is, and you'll never leave. So it's that kind of thing. There's a bunch of things that can be focused on now.
Well, for somebody that may not have engaged with palliative care at this stage in their life, however, it may happen. Just tell me the difference that a quality palliative care trained professional can make, as you say, at the end of life.
It's about comfort, having a sense of comfort that the care you're receiving is what you need to receive, when you need to receive it, and where you need to receive it. It's about knowing that care is available to support you and your family. It's not always about the medical care, but that's a really important part of it. and you need to be confident that your pain and symptoms are managed. But it's also about that wrapping around of a person and their family that a palliative care team can provide.
Well, it sounds like we're getting somewhere.
Yep.
Things are moving forward, both in terms of, as you mentioned, the training, the funding. I guess the sheer acknowledgement that this is a serious health issue that can't be ignored. We've heard it mentioned in the Aged Care Royal Commission how important it is. So, do you feel that at last we are turning a bit of a corner?
I do. I most certainly do, and I think, and I'll leave the aged care comments to Camilla, but certainly within New South Wales and the commitment to regional support in the palliative care budget, but also in the budget generally to support health professionals to go into regional areas is incredibly important.
Well, look, I thank you so much for giving me your perspective from that state perspective, Linda Hansen. I'll just put you back on hold and go back to the federal perspective with our CEO of Palliative Care Australia, Camilla Rowland. Camilla, do you feel that we've turned a corner?
The corner that's been turned is about recognition from the Royal Commission into aged care that palliative care needs to be embedded in the aged care reform. From the Royal Commission, of which we did some fairly significant submissions, most of our recommendations were accepted. But people will be really surprised to know that palliative care hasn't been embedded in the aged care system in Australia till now. And yet 36% of all deaths in Australia occur in residential aged care facilities, or as we often call them, nursing homes. It's really quite surprising. You're talking around 60,000 people per year that die in aged care facilities. So it was right that the Royal Commission did focus on that. So what's come out of the Royal Commission in terms of turning the corner is that they've recognised that the new Aged Care Act needs to be rights-based and including the right to receive palliative care. They've recognised that the aged care quality standards need to have inclusion of palliative care. They've recognised that there needs to be aged care programs embedded into the aged care system, including training and accreditation. But where we're up to at the moment is the reform is being worked on by the Commonwealth Department of Health, and we're involved in those national committees that look at those reforms. The issue is that we now need to see the money flow into that. So each of those strategies that's now being developed and actions that are being developed, we need to make sure that money flows into embedding palliative care into the aged care system.